of fitting the coil, but it's not a common event. If a woman with a coil does develop a severe infection like a PID, she needs urgent treatment. And something that's very rare though, women who've had the IUD for a very long time may be more likely to develop some type of chronic bacterial infection. Another reason that many women find the coil not their cup of tea is the worry about how difficult it might be to remove it. This is usually something that applies to a woman who had a really bad time when her coil was being fitted, or if it's difficult to reach the threads of the coil, or in some rare instance where the coil itself has fixed to the lining of the womb. This one is one reason why women don't like the coil. Failure, the fact that it fails and they become pregnant on the coil. Yes, an unlucky 1 to 2% of you can experience method failure while on the coil. I know it's not funny. It's possible, but it's a very, very low risk because it's such an effective method. Having said that though, important to note, even though the risk is low, if pregnancy does happen, there is a chance that that pregnancy will be ectopic, so it is located outside of the womb. That is, in the very small chance that the pregnancy occurs, it may be an ectopic pregnancy. Please bear that in mind, although the risk of it happening is very low. Another worry is fear of cancer. Now, this is related to the progesterone coil in particular, where there is a small risk of breast cancer associated with using the coil, regardless of how long you've had the coil fitted. But let's put it in context, because remember that all hormonal birth control do have a small increased risk of breast cancer, and this is thanks to the hormone content, of course, although the risk is still relatively small. According to a large study, regardless of age, there was no major difference in breast cancer risk between women using the progesterone coil like Mirena or Jades or Skylar and those who didn't. So please, this is a discussion that you must have with your provider regarding your concern about cancer. Whether or not you have a family history of had cancer before